G'day everyone, this is Health Highlights. Health Highlights is a show about health, health professionals and the people and the stories behind the names we hear about but we seldom get to meet. Acupuncture. It's been around for 4,000 years, but there is so much controversy around this amazing therapy, and so we wanted to get to the bottom of this controversy, and who better to talk to us about all things acupuncture than a GP and a medical acupuncturist herself, Dr. Zinni McTaddick. How are you, Zinni?
Fine, thank you, Simon.
Thank you for joining us. Now, Zinni has had 20 years experience as a GP and 4 years experience as a medical acupuncturist. So Zinni, what is acupuncture?
So, to put it simply, acupuncture is a form of therapy where we put in very, very fine filiform needles into specific points on the body with the aim of restoring your body's health, so get back to health.
Fantastic. And so, how does a GP find themselves getting into acupuncture?
Okay, so the story is a personal one. So my daughter, when she was 13, developed these terrible chronic daily migraine headaches. And it was very difficult to get it under control using traditional Western medicine. Nothing seemed to work. And a colleague of mine has been an acupuncturist for far longer than I have been, so I took my daughter to her, and really acupuncture was the only thing that really turned the volume of the headache down. So I can't say that the acupuncture made it miraculously disappear, but it certainly was useful in managing her pain. So from that, I really wanted to learn that modality as something that I could actually offer to my patients who also have chronic issues.
Fantastic. And so you've been doing it now for 4 years.
Yes.
Have you been surprised by the effectiveness of acupuncture for some of your clients?
Yeah, well, when you're first starting off with a new modality, there's all those questions of have I learnt it properly? Is this going to work? And I do have to say, I would not have done it if I weren't already convinced about the scientific evidence behind the treatment. And so, yeah, it's very reassuring as I go along and treat patients that it certainly does seem to have a positive effect.
Fantastic. And so, what are the foundation principles and I suppose values that acupuncture has, and how does that work?
Okay, so acupuncture, there's a little bit of history here. So acupuncture is actually one treatment modality within the bigger field of traditional Chinese medicine, which is thousands of years old. So their view is rather different from the way Western medicine developed. So they didn't actually cut up people and study the anatomy. So what they did do was study the effects of the treatments that they had in live patients and really meticulously noted down the effects that they saw in live patients. So their view of bodies, human bodies, is that it's actually a microcosm of the natural world, and that the human body or humans and the natural world are intimately related, and that whatever might go amiss in our bodies is a reflection of or tied in very closely with our relationship with each other, so social environment as well as the external physical environment. So that kind of underpins the rest of their theory about how disease occurs and how we actually help people manage that.
Wonderful. And I suppose that plays into the whole, everyone talks about qi or energy. Yep. So can you sort of unpack for us what qi and energy is and how that plays out in the healing relationship?
Sure. So Chinese medicine does use these terms that are very, very foreign in the West. So what is qi? What is channels that or meridians that the qi is supposedly meant to travel in? So qi is, we do translate it in the West as energy, but it's not the same as electrical energy or heat energy as we understand it here. It's really about the thing that actually animates us and gives us life, and it's also about the organisational aspect of that. So qi is present, right at the formation of life. While where start as a single cell that divides into 2 cells and then divides into more cells. I mean, what is it that actually then helps that collection of cells to differentiate, to make the complexity that we are as humans? And that is qi. The force that does that is qi. And the ancient Chinese figured out or plotted that this qi travels in a number of channels within the body, and that they related to the organs that make up our body. And again, I mean, I guess one of the difficulties with getting these sorts of concepts to kind of marry with Western medicine concept is that we do use words like kidney, heart, stomach, spleen, but they don't actually mean the same thing that Western medicine talks about when they talk about that. So in Chinese medicine, those words are really about the function of those organs and not so much about their location or their or how they look like, what they look like. Yeah. So I guess that underlies some of the difficulties in having acupuncture accepted within Western medicine as being a part of that. But I think it can certainly inform Western medicine, and acupuncture or traditional medicine, Chinese medicine, can work alongside Western medicine.
Awesome.
Yeah.
And it's really interesting hearing you even as you talk, just that little... That the battle between the two and how that works and how it all fits in, and it was actually quite fascinating just to watch you answer that question. And so my next question then is, so science is coming out now and they're showing that yes, acupuncture has validation and is good for us, and therefore there is research showing that is actually definitely helping in pain. So can you talk a little bit about the research behind and what Western medicine is finding about acupuncture today?
Sure. So a lot of the studies are to do with pain, and I guess there's a bit of a historical context of that. Acupuncture as a therapeutic modality really, the interest in that took off, after President Nixon's visit to China, where one of the media staff actually had appendicitis and was treated with acupuncture to manage he actually had an appendicectomy, and the post-operative pain was managed by the use of acupuncture rather than medication. And he wrote about it when he went home, and that coincided with some studies that were done quite independently of acupuncture by Wall and Melzack, who were trying to actually come to an understanding of what pain was, how do we actually experience pain, and why is it that some people end up with chronic pain. And they came up with a theory about how our nervous system communicates with the brain to actually tell us, protect us from things that are actually causing injury to us. And that theory, the gate theory of pain, seemed to actually explain some of acupuncture's effects. So when you actually put a needle into the skin, into a specific spot in the skin of someone with pain, that actually triggers a nervous system signalling to the brain that actually, through complex pathways, actually does shut the gate to the message of pain being received by the brain.
Wow. Well, that's really interesting to hear that. I mean, it's a bit like that when you whack your arm and you rub it, it actually stops that pain sensation a little bit, because the sensation actually goes faster than the pain.
Absolutely.
And so therefore it closes the gate. So very similar concept. Okay, very good. So there's lots of confusion out there and misinformation. Can you sort of talk a little bit into what that looks like and why is there misinformation, and how do you address that?
Yeah, I don't really know, Simon, about misinformation. There's scepticism. I'm certainly aware of the scepticism, and that is again what I said before about the language that's used. And I don't mean this in a disrespectful manner, but in Western science, you know, we've been very good at paring things back to the most simple and opening things up and finding structure and, you know, where, you know, actually identifying nerves, identifying blood vessels. So when the Chinese talk about qi travelling in meridians, you know, the natural thing is, well, where are they? And to date, you know, we haven't been able to say, da-da, you know, this is the vessel that is the meridian. Although there are, you know, several theories about what that could possibly be, and probably the most likely thing that it is that it is related to the interstitium, which is, or the myofascial plane. So that's the soft connective tissue that basically binds everything in our bodies together, so that if you actually can, you know, do away with, get rid of everything but the facial tissue, you will actually get an outline of the body, including the organs, you know. So, and the interstitium is not a dead thing, it's a live thing. It's actually can transport you know, biochemical, neurochemical substances. So it's most likely the thing that is the closest thing to what the Chinese were saying were these channels.
Wow, very interesting.
Yes.
That's very interesting. So now, I know we'll go off the science there for a minute because that was very deep and really wonderful. What equipment do you use? Because I know that some people have quite concerns about needles. So what things do you use in acupuncture to assist?
So primarily I am using needles, and they are very, very fine needles. They're, you know, almost like hair-like fineness. And I guess that's partly because it's a very good electrical conductor, and the thing that we're doing at the point of the needling is having an effect on nerves. And there's an electrochemical, you know, action potential thing that we're actually stimulating there. But you can still have an effect without the use of needles, and I mean, acupressure comes out of that, so you can actually have some effect by using pressure on the points. But the other thing that I like to use is laser, what was formerly known as cold laser. So it's just red light. It doesn't burn, doesn't cut. It's just using red light to stimulate those points. And I would use that for people who, you know, maybe have needle phobia, or maybe have problems with their immune system. If they're undergoing chemotherapy, for instance, I would not be putting needles into people who might be at much greater risk of having an infection by having something inserted. So in those sorts of instances, I would certainly be avoiding needles and using laser instead.
Wonderful. Well, there you go. Well, look, I found that extremely fascinating. Thank you for your time, Zinni. We really appreciate your insight and loved hearing about acupuncture. Look, if you're out there and you've got chronic pain or you're interested in acupuncture, I'm sure Zinni would be more than happy to assist you. If you want to find any more information about Zinni and where she works, all the information for her practice will be on the screen right now. Thank you everyone for joining us, and thank you so much, Zinni. I so appreciate your time. Have a wonderful week. Remember, healing is a gift. Health responsibility. We'll see you the same time next week. See you later.